Now, for more on China's healthcare overhaul, let's bring in Xi Chen from the Institute for Social and Policy Studies at Yale University. Welcome to the show.
Hi, Rachelle.
Now, let's start with how healthcare resources are distributed. What do you make of the gap between rural and urban areas?
Oh, there's several gaps, but the main gap is rural and urban, especially because they are under different coverage and their insurance coverage are quite different. In rural areas, it's just a basic coverage about their daily illness, and there's a large group of people from rural to urban is largely ignored in this healthcare system. But in urban area, especially in the state-owned enterprises, those coverage are more generous. Recently, the Chinese government is trying to do more to have better coverage for people not only in urban but also in rural. For example, there are some new policies trying to have called catastrophic illness coverage to have new insurance to cover based on the very basic social insurance. So, for example, if there's a catastrophic illness, then that will be automatically covered through this new medical scheme. But I think the most important thing is that we have to focus on how to optimize this system to try to put down more resources from the secondary and the tertiary care to more community-based medical care, especially, for example, the family doctor system.
Right. Now, as you mentioned, having this hierarchy so that everyone's not kind of rushing these main hospitals and really bringing it down to the community. So within that shift, are there any populations that tend to be overlooked, perhaps, when it comes to healthcare in China?
Yeah, as I mentioned, there's a large team of people, about a team from rural to urban. They are very mobile. They are the migrant workers. The size is above 200 million population, so they are largely ignored because they live in the city, but they have to be treated in the rural, in their home county, which is very inconvenient for them. That's why they are largely out of this system.
Now, another thing that we're also seeing is an increase in patient-doctor violence. Why do you think this is happening?
Oh, I think the fundamental issue is that there's overcrowded hospitals and patients have very limited time to communicate with the doctors. So there could be miscommunication, but the fundamental issue is about overcrowded hospitals as well as very limited resources. But if we could reform the system and try to put down more resources to the community instead of tertiary care, that would partially relieve this issue. We can have a better treatment for those really need the necessary treatment. Otherwise, we could let them be treated in the community. For example, the Chinese government is now trying to reform the system to have a hierarchical medical system. We try to send people with very light symptoms to the community to be treated. So this is a very fundamental reform trying to optimize the resources there.
Now, one thing I want to tap on, Xi, is this issue of hospital scalpers. Obviously, if there's a lot of overcrowding, you have frustrated people, and there are some people who are tapping into that. How serious is this market, and what's the government doing to solve the problem?
I think it's widespread across China because of the limited resources in the very high quality medical treatment resources. So the government is trying to do something, like, for example, to strengthen the police enforcement in the hospital. But I don't think this could be effective because this could be just a temporary solution. But something else can be done. For example, if we have a real name registration system, when the patients go to hospital, they get real name registered. That will solve a lot of this hospital scalper issues. And also, the fundamental thing is still the overcrowded system. We should solve the underlying basic issues instead of just looking at to to capture those people serving as the scalpers.
Now, Xi, I do want to touch on the Baidu scandal. We had a student who relied on information from one of these paid medical advertisers on the Baidu search engine, which led to his death. So what issues does this now bring up in the medical industry in China?
Oh, this is very tragic news. But the incident itself looks like a medical issue, but actually it's a spill over like to the internet industry, because in the internet industry now, China is largely like Baidu is having the very large market power. It's almost a monopoly in the market. So the patients can get only access to the information only through Baidu. But if we could let some competitors into the market, for example, if we can allow the Google to be serving the Chinese market, then the consumers will get multiple information. They will verify which one is is a better treatment, which is more reliable news. And also with more competition, there could be more attention for the enterprises to put on the social value instead of just put on the profit generating. But Baidu, as we see now, they put a lot of emphasis of their revenue to be on the advertising business.
Right.
So that's the issue there.
If you like what you just saw, follow us on social media and visit our website, cctv-america.com.